6 months ago, a woman named Elena walked, or rather, struggled to limp, into my clinic. Elena is 62 years old, from a quiet suburb in Chicago. When I first saw her, my heart sank. Her ankles were so swollen they looked like pillars. Her skin had a gray, sallow tint, and she told me she didn't have the strength to walk to her own mailbox anymore. Her doctors told her she was heading straight for a dialysis chair. They said it was just old age and genetics. But when I looked at Elena's daily routine, I saw something startling. Every single morning, with the best of intentions, Elena drank a large bowl of concentrated, long-simmered bone broth. She thought she was BOI, strengthening her bones and healing her gut. In reality, she was pouring liquid gold that acted like liquid lead on her kidneys. Fast forward to today. Elena just sent me a photo of herself hiking in the Great Smoky Mountains. No dialysis. No heavy medication. Her kidney markers have returned to the safe zone. Oh. We didn't use a miracle drug. We used a simple, natural adjustment to her nutrition that 97% of doctors overlook because they are too busy writing prescriptions. In the next few minutes, I'm going to show you exactly why that healthy pot of soup on your stove might be a ticking time bomb for your renal system, and how you can fix it today. Before we dive into the why, I want to see who is here with us. If you are over 50, an office worker sitting for long hours, or a mother who has recently given birth, please comment your age and one symptom you've been feeling lately. Maybe it's back pain or fatigue, down below. I see thousands of people who think their exhaustion is just part of getting older or postpartum depletion. I'm here to tell you, it is not just age. It is not just genetics. More often than not, it is a critical deficiency in the balance of a specific nutrient, specifically how your body handles minerals. We've been told to nourish, but we haven't been taught how to filter. For those who are new to the channel, I am Dr. David Thompson. I have spent over 30 years in the trenches of internal medicine, treating thousands of patients just like Elena. My mission is simple: to help you live a long, vibrant, and independent life. I don't want you dependent on a pharmacy. I want you to understand the why behind your health, so you can be your own best advocate. This channel is about scientific nutrition. No fads, no magic pills, just the biological truth. Most people don't realize their kidneys are failing until they've lost 70% of their function. They are the silent workers of the body. I want you to take a quick mental test. Count how many of these 5 symptoms you've experienced in the last month. 1. Foamy urine. Does it look like there's soap in the toilet? This is protein leaking out, a sign your filter is torn. 2. The sock ring. When you take your socks off at night, is there a deep indentation left on your ankle? That's edema or fluid retention. 3. The metallic taste. Do you feel like you're chewing on a coin? This is a buildup of uremic toxins in your blood. 4. Persistent itchy skin. Not a rash, but a deep itch that won't go away. This happens when your kidneys can't balance phosphorus. 5. Lower back dull ache. Not a muscle strain, but a deep, heavy feeling just below your rib cage. How many did you count? 1, 3. All 5. Comment your number below. When you have these symptoms, your body is screaming that it is under oxidative stress. Imagine your kidneys are like a fine coffee filter. When you have chronic inflammation or ischemic ischemia, lack of blood flow, that filter starts to fray. If you keep pouring thick liquids through a frayed filter, it's going to clog and eventually fail. Now, let's get to the controversial truth. Why would bone broth, the ultimate healing food, cause kidney failure? The problem isn't the broth itself, it's the concentration. When you simmer bones for 24, 48, or 72 hours, you aren't just extracting collagen. You are extracting massive amounts of phosphorus and, more dangerously, heavy metals like lead and cadmium that are stored deep inside the animal's bones. For a young, healthy person, the kidneys can handle this. But for my friends over 50, or women whose minerals are shifting after pregnancy, your kidneys are already working at capacity. Adding a massive phosphorus load is like trying to force a gallon of water through a needle's eye. Take Arthur, a 55-year-old software engineer. Very healthy, or so he thought. He started a health kick and began drinking concentrated bone broth twice a day to help with his joint pain. In just 45 days, his creatinine levels, a marker of kidney waste, shot up from a healthy 0.9 to a dangerous 2.1. He was lethargic, his blood pressure spiked, and he was confused. He was bo himself into a hospital bed. Once we stopped the broth and switched to a specific plant-based mineral protocol, his levels normalized in 3 weeks. Let's look at the cellular level. Think of your kidney as a waste filter in a high-tech factory. When you consume too much phosphorus from bone broth, your body struggles to maintain a balance with calcium. It triggers a hormone called FGF23. Think of FGF23 as a harsh supervisor who tries to force the filter to work harder. But this supervisor also causes the blood vessels to stiffen. We call this vascular calcification. Furthermore, let's talk about nitric oxide. This is a molecule that acts like sunglasses for your blood vessels. It keeps them relaxed and protected from the harsh light of inflammation. High purine broths, especially those made from marrow and joints, create high uric acid. This uric acid destroys your nitric oxide. Without nitric oxide, your kidneys' filters become brittle. They can't expand. They can't breathe. They begin to die, cell by cell. This isn't just my opinion. A landmark study published in the journal Environmental Health Perspectives found that bone broth can contain up to 10 times the lead concentration of the water it was cooked in. Another study in the Journal of Renal Nutrition, 2017, highlighted that patients with even mild kidney decline must strictly limit phosphorus-rich liquids, like bone broth, to avoid rapid progression to stage 4 kidney disease. Does this mean you must throw away your stockpot forever? Not necessarily. But we must be smarter. Here is the doctor's protocol for safe broth. 1. The 3-hour rule. Do not simmer bones for 24 hours. Most of the beneficial amino acids are released within the first 3 hours. After that, you are mostly just leaching heavy metals and excess phosphorus. 2. The green balance. For every cup of broth, you must consume 2 cups of alkaline vegetables, like kale or bok choy. The potassium in greens helps the kidneys flush out the excess phosphorus. 3. Source matters. Use only organic, pasture-raised bones. Conventional factory farm animals store toxins in their bones that go straight into your soup. 4. Dilution is solution. Never drink concentrated broth. Dilute it 1:1 with filtered water and add a squeeze of lemon. The vitamin C and citric acid help prevent kidney stones. Have you been simmering your broth for days on end? Or have you noticed you feel heavy or bloated after a big bowl of soup? Let me know in the comments. I read as many as I can to help guide my next videos. To summarize, your kidneys are your most precious asset for independence as you age. While bone broth has benefits, its dark side, phosphorus overload and heavy metals, can be devastating if you aren't careful. Listen to your body, not the trends. If you see the 5 signs we discussed, stop the broth immediately and focus on hydrating with pure water and lemon. If you found this helpful, please subscribe and hit that notification bell. In my next video, I'm going to share the top 3 fruits that actually act like a vacuum cleaner for your kidney filters. You won't want to miss it. Stay healthy, stay independent, and I'll see you in the next one.